All right, we are live.
Good morning. This is the Senate Health and Welfare Committee, and today is April 11th. May 11th. Just took us back a month. It's like setting the clock back. So it's May 11th, and today we are taking up the House Proposal Amendment on S20, the PFAS bill, and the chemicals bill. And we've invited Representative Dane Whitman to come in and talk with us about how the House approached the bill and the changes that were there. So Representative Whitman, thank you so much for being here. And why don't you walk us through or talk about the bill, and then we'll ask questions when you've finished. So just a few minutes
Okay.
on the bill, and then we do have some questions for you. But I will say, overall, it looks to me that some improvements have been made, and then you've kept some good parts of the bill. So overall, I think we can get to some closure on this. So, but thanks for being here.
Great. And thank you, Madam Chair, for having me. And I just wanted to say thank you to you and the committee for making S20 possible, making it a reality. We really appreciate your leadership in the Senate on this issue, and it's really been a privilege to be a part of that work. So just thank you so much. Yeah, just to highlight a couple changes that I'm sure you've noticed. I'll just go through three right now and see if you have any further questions after that. I'm sure that you noticed the additional part in the firefighting foam section that has to do with sort of a extension on the deadline for one facility, this bulk petroleum terminal. And that was based on testimony that we received that they just wanted to be sure that a fluorine-free alternative was available that would meet their fire suppression specifications. This deadline that we have of January 1st, 2024 is just a few months after the United States Secretary of Defense is scheduled to completely transition to fluorine-free foam. So we thought that that extra 3 months and seeing how that determination went would be helpful. And I'm sure that you also noticed that sort of process for applying for an additional 1-year waiver. And one of the things we appreciated about that process is it does sort of review the work that is available as far as what fluorine-free foams are available and if they'll meet those specifications. So really just a really narrow carve out that I'm optimistic will be met at that January 1st date. So that is one point. The next point I will go to is in food packaging. Just a couple additional language around the bisphenols section for Department of Health rulemaking. We received testimony from a manufacturer actually in the state of Vermont that was developing a product to create an epoxy resin, which they were very confident that they had clear and convincing evidence that it was non-toxic. While at one point they added a bisphenol to the material, that the final product was not endocrine active, non-toxic. And so basically this language really putting the burden of proof on proving that it's safe for use was something that we felt comfortable with. In that next paragraph as well, looking at the sort of alternatives assessment, we received testimony from the Department of Health that they had some concerns about performing their own determinations around alternatives assessment. So we added just one line there saying that they could also sort of consider the work of another state. If another state is doing this work, making alternatives assessment, that the department can make rules according to that as well. The final thing I'll highlight is Section 5 around the chemicals of high concern for children. And that's also based on testimony we received from the Department of Health. And I'm sure we'll hear from Mr. Englander about that regarding the original Senate bill that included adding the class of PFAS chemicals. We received testimony that that could not be implemented at this time. So we felt to maintain as much as we could of the section to essentially add these 3 PFAS chemicals that are currently being monitored within our drinking water safety standards. And yes, I will leave it there, and I'm sure happy to answer any questions.
Thank you. That was really terrific, clear, and you identified some of the areas of concern that we had as we went through the bill. Before we go to anyone else, to David Englander of Department of Health, questions committee for Representative Whitman. Go ahead, Senator Hardy.
Thank you. And thank you for being here today, Representative Whitman. I have a few questions, but I think 2 quick ones. You and I had a conversation at one point related to the food packaging and the bisphenols, and I recall we were talking about cheese sticks and whether, the sort of packaging that sort of is sucked on to a piece of food. So your definition, I'm trying to find it in the bill, but do you feel like the definition that's in there now would include that type of packaging?
Thank you, Senator Hardy. Yes, I do. I think that really just making it clear that if there is direct food contact, then that falls within.
Okay.
We feel confident that.
I just remembered our cheese stick. I put a lot of those in my kids' lunches, wanted to make sure they were covered. So, and then
But not by BPA. That make sure they were covered, but not by BPA.
Exactly, exactly. And then the other question that we also talked about in the terminals language that's been added, and I was kind of confused because when I think about a terminal, I was thinking it was an airport terminal, but this is a completely different kind of terminal that just has a lot of stored petroleum, apparently. Yeah. So do you know how, or maybe you said this and I missed it, how many of these are in our state?
Yeah, thank you, Senator Hardy. There's one facility that would fall under this definition. Yep, it's in Chittenden County, and essentially, yeah, it is a sort of depot that stores large tanks of gasoline, which then distributes to gas stations throughout the area. So they were just these large tank fires are really this narrow application where, where they think that AFFF may still apply given current technology.
Okay, but they're working toward a foam that would not include PFAS, and the dates in the bill sort of align with that.
That is correct.
Okay, and my understanding also is that this place has never had a fire, at least at this point, knock on wood.
Correct. And I will reiterate that testing and training and testing any kind of discharge of foam for either of those purposes is completely prohibited. Actually, with the effective date of July 1st, 2022. So even though they have this sort of extended deadline, they still can't use it for testing or training. We received testimony that the current practice that this facility is using of essentially discharging foam into a vacuum truck to test their water to foam ratio is not necessary. There are like alternative means of testing. So we do want to kind of limit any of that discharge of foam for emergency use only.
Okay, so only if there was a fire would it be used. Okay, okay, good. I have other questions for Mr. Englander, but thank you very much. I appreciate it.
Thank you.
Terrific. This is really helpful. Your deep dive into the firefighting foam is really very much appreciated. I know there was a lot of pressure to do more, but I think you've done you've done what I think needs to be done right now.
Thank you, Madam Chair.
Other questions for Representative Whitman? Senator Hooker.
Thank you, Senator. Thank you, Representative Whitman. We did have a question last week about why the term clear and convincing as kind of a legal term. How did you come upon that for deciding, how to determine whether or not they had this proof?
Thank you, Senator Hooker. Are you referring to the fire foam section, food packaging section? Is there a certain section in
I
particular?
think the packaging section, you had talked about
Food
clear and
packaging.
convincing.
Yeah. So I believe that's a great question. I wonder actually if Mr. Englander could comment on that at all. But I think essentially that is going into clear and convincing evidence of a safe alternative, really just putting that burden of empirical evidence, peer-reviewed studies, kind of getting to that next level of something more than an op-ed or something like that, talking about the potential safety of another alternative.
Yeah, so Senator Hooker, do you have a follow-up?
No, just I think
Okay.
maybe Mr. Englander can talk about
Right.
what the meaning is as far as
We'll ask that question. I know you, Representative Whitman, I think that appears two times in the bill. As I looked at it, it wasn't, it didn't detract from the goals within the bill. So we'll listen to what David Englander has to say from the Department of Health perspective.
Yep.
Having peer reviewed is another, probably more appropriate for scientific, but
Right.
Given where we are and the language that we have, it would probably can live with the good rather than the perfect.
Thank you. And I will just say too, if I may, Madam Chair, because I do see this is also in the firefighting foam section.
Yes, it is.
And I think we expect, since the Secretary of Defense has this goal of meeting their October 2023 deadline, that there will be a large body of evidence of testing and trials and studies that the Department of Environmental Conservation will be able to pull from in determining whether or not alternatives are available.
Yeah. Thank you. Okay, any other questions for Representative Whitman? All right. David Englander is here. Welcome.
Good morning, Madam Chair and committee members.
Thank you for being here. And did you want to add any comments before folks ask questions about the bill itself, or some of the, we did send you a list of questions and you responded, and thank you for doing that. Did you want to start with anything, or would you prefer to have us just go ahead with our questions?
I'm happy to answer the committee's questions. I do, for the record, I want to introduce myself. My name is David Englander. I'm the Senior Policy and Legal Advisor to the Commissioner of Health. But with that, I'm happy to answer the committee's questions.
So I think, go ahead.
I was going to say, I do want to say, in terms of my testimony was fairly narrow. It was focused on the job that the bill, the department was, the jobs that the bill was assigned to the Department of Health.
Right.
So I came to the bill as sort of as the regulator more than anything else.
Yes. So why don't you, we asked the question about the rulemaking process and the role that the Department of Health plays as compared with the role of DEC or the AG's office. Maybe you could talk a little bit about that with respect to other chemicals that are regulated.
Well, the question from the committee, or from you, Madam Chair, or actually, I believe it came from Katie McLean, was, is there a discontinuity between the certificate of compliance enforcement provisions being given to the Attorney General's office, but their rulemaking authority being given to the Department of Health? And my response was that it says that we shall adopt necessary rules. So the actual the necessity will be determined by how things play out, and that it is absolutely common for the Department of Health to adopt rules that are enforced by the Attorney General's office.
So if you say that no more than X amount of PFAS should be found in food packaging, then it's the Consumer Protection Division at the AG's office that would maybe do a spot check or ask for a certificate of compliance.
Precisely.
Yeah, okay. That makes sense in terms of the division of labor. Okay. All right. I do have some questions. They may not be exactly related to the bill itself, but just going forward. So I will open it up for folks. Any questions, committee, for Department of Health? Go ahead, Senator Hardy.
Thank you, David. It's nice to see you. I feel like there's it. We're always talking about chemicals every time I see you. First of all, thank you for the clarification from both you and actually Katie. Thank you for reaching out to the AG's office and to Mr. Englander. I feel better about the rulemaking process situation, so that's great. I wonder if you could speak a little bit. I know you provided, quite a bit of testimony in the House about the PFAS, chemicals of high concern for children situation, and why the House ended up where they ended up with just listing 3 particular chemicals rather than the whole class. And if you could just give us a summary of that, that would be helpful.
Sure. There are more than 9,000 PFAS chemicals on the market, and the department has substantial experience with dealing as a regulator of chemicals of high concern to children, and both manufacturers and the department and the AG's office really need some level of precision as to what chemicals are actually being regulated. So the example was 2 years ago, we tried to adopt a provision that said any chemicals that were formaldehyde donors, so donors that were intentionally added to chemicals for the purpose of decaying into formaldehyde. And the universal response from manufacturers was, we need to be told precisely what they are. So in turn, we chose 10 of the most widely used donors. But it gave us the experience that it really is important for both regulated community and for us as regulators to be very specific in terms of what is being regulated. That's part 1 of 50 parts. So part 2 is that there is very little science on most PFAS chemicals. We have good science on 2 to 3. We have science on 5. But the other 9,000 or so, we don't have any, or very, very perilously little. And so there would be insufficient information, scientific information, that they would meet the criteria listed in the statute that they should be listed as chemicals of high concern. So my testimony was that if we listed all of them and there wasn't some sort of legal guardrail that kept them on the list, a party could come and ask them to be delisted the following day, and the Department of Health wouldn't have the ability to say, to make an argument, to muster an argument they should be on, because there's no information. There's no information to form the basis for their listing.
Okay, could you explain, because it's not in this bill, it's obviously in current law, the process for delisting? What happens for that?
Sure. So the criteria, and I don't have it off the top of my head, although I should have, essentially to be listed, a chemical of high concern to children has to be, it has to have known negative health effects, and it has to exist in human tissue, in the environment, in breast milk and blood. And so if something is listed, it's met those criteria, And to be delisted, it simply is a rulemaking petition. And we have had probably a half a dozen of those over the past 5 years, where typically a manufacturer would come and say, we believe this chemical no longer meets these 2 criteria. They provide us scientific information, we review that information and determine whether to be delisted. So it looks like any other petition for rulemaking under Title III. For folks' knowledge, we've actually declined all. I believe there's been 5 petitions, and we've declined all those petitions and felt all the chemicals still, in fact, did meet the criteria.
So how does it, besides this whole process of creating a law, which is long, is there another way to get chemicals on this list? My concern is with 9,000 PFAS chemicals, we're only putting 3 on. What happens if in July there becomes clear and convincing evidence that another one of these chemicals
Peer
is
reviewed
peer
data.
reviewed? Thank you. What happens then? Can the department put it on then?
So that's a great question. So there's a little bit of an oddity with this law, which is that there were originally 66 chemicals listed in the law, but those were then put into rulemaking, and the list can be modified via rulemaking. Chemicals can be either added or subtracted. So the Department of Health has added, following the original 66, we've added 20 additional chemicals, as well as 10 donors of formaldehyde. So the usual process is that the chemicals are added by the rulemaking. So if in July we found that there's peer-reviewed evidence that methyl ethyl bad stuff 2, meets the criteria, we would then go into rulemaking to add that chemical.
Okay, so you don't need legislative action. You don't need a law to change it. Okay.
But remember also, that is only for chemicals of high concern for children's products.
Correct, right. And so it's only for this list, this part. So do you have people at the department who do this? Is there somebody who's sort of on this at the department, especially now, given everything that you're dealing with?
So, well, at the moment, I think as the committee knows, we're fully deployed to the COVID response. The state toxicologist works approximately 23 hours a day. There's also a program person who works with chemicals of high concern to children. So we still have the capacity to do this, but certainly that resources are thin at the moment.
Right. Okay. And one more question, and then I'll, this narrowing of the PFAS from the full class to these 3 chemicals in the bill, it's only in the chemicals of high concern section, correct? So like with ski wax and packaging and firefighting foam, it's the whole class. Is that correct?
That's correct.
Okay.
And actually, I probably should have stepped back for a moment for members of you who are not so familiar with Act 188. So it has to meet the criteria of having a negative health impact, has to be present in the environment or the human body. It is then put on a list, and it has to appear in a children's manufactured product. And if it appears on the list, the manufacturer has to disclose the presence of that chemical to the Department of Health. The Department of Health then makes that information public.
Okay. Thank you. I think this is the part that I'm the most concerned about with the bill, and want to make sure that we stay on top of it, that the department does and that we do, as more scientific evidence becomes clear about these chemicals. So I'm wanting to make sure we have some process in place and people who are doing this, monitoring.
It's relevant to note that we do have 2 PFAS listed in the chemicals of high concern. There's been no reports. We have more than 4 million reports on the basic list, and not one has come back with PFAS, with a PFAS, just so the committee is aware. So when we're looking at prioritizing chemicals to be listed, because of the lack of presence of known PFAS, I'm being frank that it wouldn't be number 1 on the list because they don't appear to be they are not appearing in goods, in children's manufactured goods in Vermont today.
That's
Got it.
good news.
So there are other chemicals that are floating to the top, so to speak. Okay.
Literally.
Yeah. All right. Thank you, David.
Okay, committee, other questions for Mr. Englander? As I want to thank you very much for the hard work that you've put in on this bill. I know that whenever we get a chemical bill, it's never easy because of the lack of clinical data about people and linkages with chemicals. It's not an easy lift. But I do have a couple of they're questions, but I don't need responses for now. It's simply that I will be perhaps reaching out to the department, and it may well be through coming legislation. But so the questions about notifying the public about some of the chemicals of concern that we have and how we let folks know that we are acting on those. And I know sometimes manufacturers use it to their advantage, their marketing advantage, and say does not contain BPA or whatever, that works. But the other area is on the access to the information on the DOH webpage. And right now it's a pretty cumbersome page. I'm not trying to put pressure on the department during a pandemic, because the outstanding work the department has done speaks for itself. But going forward, this is an area that I would have some concerns about. And then that consumer product information that's available to folks, I think important to keep that in mind. And then how, and sort of associated with that, obviously, how other states are doing that. Are there other models out there that might facilitate the work that the health department is doing? So those are some of the questions that I have. You don't need to respond to those. I don't think that's probably been on the top of the list for the department in recent months.
May I just say that, I can just sit here, but
you can please respond.
The department shares your concerns. We share the goals of making it for folks that don't know, haven't spent time on the VDH website recently. You have to download an Excel spreadsheet to get the information. It is not easily accessible by consumers. We share I think that the committee's goals of making it easily accessible to consumers. The program actually has brought in much less money than we all, and Senator Lund, I think you and I have discussed this in years past. It's brought in less money than we anticipated. So we've not had the funding available to create a more frankly, reasonably accessible website. Other states actually don't have, that I've seen, don't actually have more useful information, if anything, because other states, such as Washington, collect a CAS number information. So it's not SKU number. It's not this red cup with the white interior. It's just cup.
Right.
So a consumer can't figure out, even if they had, actually
information.
Right.
Okay. All right. Thank you for that. So at any rate, we will be very interested in how the information progresses. Okay. Any other questions for Representative Whitman or Mr. Englander? Katie, have we covered all of our questions? I think so. She's there. Okay. All right, we're good. Committee, we've looked at this. We looked at this last week, and I'm wondering how the committee is feeling about S20 at this point. If you would like to, I'm actually asking you, are you okay with the proposal as it's come from the House? Do you need more time for discussion and decision-making? I see Josh. I see Ann. I'm good.
I'm
see
okay
you.
with it. I'm concerned still about the PFAS thing, but I completely
Yeah.
understand how we got here. And I agree, Madam Chair, with if there are ways we can in the future work on making it more user-friendly, that would be
Consumer
helpful.
friendly, you're right.
Yeah.
Senator Hooker?
I'm fine with it.
Oh, good.
There we go. Let's
So,
move it.
so that's great. I think Representative Whitman, you're here. And again, thank you for all the good work that you've done on this. I know you've dived headlong into it. And we appreciate that a lot, very much. So there's nothing else that we have to do. Did we take a full vote on this? I'm trying to remember. Can I see a show of hands and all those in favor of supporting the S20 as it came to us from the House? Please raise your hand and say aye.
Aye.
Good. So that's a 5-0, and we'll concur with the House proposal amendment. And I can go through thank heavens that Katie's given us the side-by-side. That makes it easier on the floor. So that's great. And
Yeah, I think it's up today, right, Ginny? I think.
we could do it today. And I'm fine with doing it today. I won't have the great big floor speech, but I can just say, go through a few things. Great. And FYI, I'm going to be sending you some information out about the bill probably in a couple of days, probably in about 5 or 6 days, that I will share with you from some national people. We'll see how it goes. Okay. Anything else on that?
If I may just thank you
Yes.
again, Madam Chair.
Oh,
and
thank
committee.
you.
It's great working with you and really a privilege to be involved. Thank you.
Well, it's so good to have you here.
Job.
It's
Thank
nice.
you.
We got it. We have another member of the team in the House. I really enjoy working with folks, my friends in the House. So now we have another friend in the House, not just on this bill, but other things. It's really great. Thank you. Thanks for being
Thank you.
here. Okay. Katie, is there anything else we need to know? Not from you? Okay, before you go, and I forget when it all transpired, but remember I mentioned to you a proposal of amendment that might be coming to us from the House Human Services Committee on H-171, the child care bill. And so I talked with Jessica Brumstead, was the representative reporting that bill. I did talk with her, and the proposal is on section 10. I don't know if you can remember section 10. That was a section where we had some criteria put in when the block grant monies were being distributed. And so that section would have had we would have had the Department of Children and Families reaching out to stakeholders. I forget, we had a working group or something. What's coming back to us, and that was taken out by approps. What's coming back to us from the House is a section that asks for DCF to reach out to stakeholders with specific criteria to consider when the block grants are given. I don't remember all the criteria, but some was related to diversity issues, equity issues, and so on. So I saw that and I reached out to our approps committee, wanting to make sure that this would, because now that there's a little bit of that in the budget. So we wanted to make sure everything was coordinated. And so that coordination has taken place both in the House and in the Senate. And so what's coming to us when we get it from the House will be synchronized, will have been synchronized with the budget, so we can read it and support it, unless you see something egregious. But Katie, do you want to say anything more about the content of that? Is it only section 10 or was there section 11? I forget how many sections are in it. I'm not hearing you. No. Try again. Still not hearing you. Okay, we'll wait for you. We'll just wait for Katie.
Senator Lyons, is the language going to come back to the committee? How, or is it going to be in the
It's
budget?
a further proposal of amendment to H-171.
Okay, okay.
Yeah. And so we will have some time. We can look at it. And if there's a need to look at it in committee, we can do that. But I'm hoping that it's similar enough that we don't have to. Katie McClinn, are you here?
I am. Can you hear
Oh,
me?
good. Yes.
Okay.
Terrific.
I do have the house calendar pulled up in case you wanted to actually see the language, but
Yeah, let's do it. Let's do
okay.
it. It's on the count. It's on for today, or is it on notice for today?
It's up for action today.
Oh, good. Okay.
Let's see. There we go. Are you seeing the calendar?
Right now, yep.
Okay. So just to kind of refresh your memory, the original version that came over from the House had what I kind of think of as companion sections or sister companions in section 10 or 11. There were two separate pots of money for childcare that were part of ARPA, and section 10 of the bill dealt with the Child Care Development Block Grant. Section 11 dealt with the stabilization grant. After the bill left the Senate, section 11 dealing with the stabilization grant had moved to the budget and was deleted from H-171. And section 2 had a working group with regard to the block grant. And that language with the working group was removed. And instead it was a report back on how the money was spent. So now the House plans to vote on a concurrence with further proposal of amendment. And you'll see right in the heading that this language deals with both the block grant and the stabilization grants. And then in kind of making this work with the budget, the language that was in the budget that kind of took the place of section 11 is going to be removed from the budget. So this language has not a working group, but again, it's a consultation. DCF is to consult with various individuals about the two pots of money coming through ARPA. And you'll see that there's language specific here that we're talking about money in excess of money specifically allocated through the child care stabilization grants, because as you know, there's already been some money set aside for the workforce program. So this is saying everything else we want you to look at and come back with a plan for how you plan to spend it. But we're kind of acknowledging that some of this money has already been allocated for workforce stabilization programs that are in H-171. And so the plan is to come to the chairs of the two subject matter committees in the Senate and House, and also to the Joint Fiscal Committee. And the plan is to consider the following priorities, but need not be limited to consideration of these priorities. Most of the items on this list come from the original House version of the bill, with the exception that Head Start has been added, and that came from the Senate version of the bill. So we have language about funding necessary for the copayment and CCFAP to not exceed 10% of the family's gross annual income, expansion of CCFAP to families whose incomes are up to 400% of FPL, increased access to high quality infant care, access to high quality, affordable childcare for culturally and racially diverse families, support and assistance to stabilize regulated, privately operated center-based childcare programs and family childcare homes, the identification of any statutory or regulatory barriers to using ARPA to address the immediate and future childcare needs of Vermonters. And then lastly, the Senate piece, the fiscal impact of the pandemic on Head Start. And then there's language here that has to do with the funding for the workforce piece. So right now the plan is to use ARPA funds for the childcare workforce piece. And this basically says if for whatever reason we find out we cannot use that, the plan has to include a way to kind of offset that with state funds. And then the second instance of amendment is just more technical. And that is that we have a heading change in section 10. So that is reflected here, the title change. And the version that went over to the House still had section 11 in the effective dates, even though it was deleted for the bill from the bill. So that's removed here. And that's
Okay,
it.
Yeah, good. It's changed a bit since I first saw it and before the negotiations with the appropriations committees began. So they've sorted out the funding piece and the synchrony. So that's good. Questions for Katie on that?
Well, just a question for you, Madam Chair. You just alluded to it. So I just wanted to make sure the Appropriations Committee, because I know our Appropriations Committee took it out originally. So they've been in the
Right.
loop on
Yeah,
this
well,
language.
You just hit the nail on the head. So when Representative Brumsted contacted me about this and said, we have a further proposal amendment, and I saw it was section 10.
Yeah.
Whoa, the lights went off and the thunder rolled. So I did make contact with Jane and with Senator Kitchell, and then started the ball rolling so that because their appropriations committee had not seen this either. So we got everybody together so we could fix it up.
Good.
And
Okay.
and Katie fixed it.
Yay, Katie.
She did. All right. So that will be coming to us. And here's my thinking. The House is acting on it today, so we'll hold off and hopefully it'll come over as a further proposal amendment that we can then, Nellie, let's have a quick meeting tomorrow morning, not tomorrow morning. When will we get this? When will we see this on our calendar? If they act, does it have to go through 2 readings? Trying to,
I don't believe it has to go through 2 readings.
Just one.
So I believe, but it might be a day's delay.
yeah.
So I'm not confident that you would have it tomorrow.
Well, Nellie, let's put a meeting on for Thursday morning. Ann, does that work for you and your committee?
I don't know.
Okay. Well, keep us posted. So it will be.
It should, but
Yeah.
Natural Resources has dropped a little bomb on us this week.
Oh,
A non-controversial amendment is clogging my emails with controversy.
I wondered what that was. I was like, why are we getting these? So
uh-oh.
So, but if we don't extend the deadline, the entire program dies. So I just asked Senator Bray to please fix it.
Yeah. Let's just fix it. Okay, so let's hold, Nellie, we're going to
But
hold
we may
Thursday.
we may be meeting.
Okay. So we'll hold Thursday and look at, if we can't meet Thursday, it seems to me, unless there are significant concerns about this, it does reflect what we had wanted initially. So I'm thinking we could also set up a real quick meeting at noontime on Thursday. So hold those 2 times open, please. So 9 o'clock Thursday or 12 o'clock Thursday. Let's make it 12:30. 9 o'clock or 12:30 on Thursday. And then if we'll just take a quick vote. Yes, ma'am.
I have a question about the another thing, which is the appointments.
Yeah, good question.
Okay, I talked to my two peeps and they seem
Yes.
great. So I just want to make
Okay.
sure that we get them on the,
All right, let's do that. We have 5 minutes. Any other questions on 171 or comments? Katie, are we all set? Perfect. Thank you. Thank you for that. I know it was kind of a hustle, and I feel responsible for causing all the hubbub around it, but I did not want to have that come over to the Senate without having had a conversation beforehand. So I'm glad we fixed that. Thank you. Okay, so I have not heard back from my appointee. Who else has heard back? Okay, so Ruth, you go first. Your two people, quickly, who they are.
okay.
and- Yep.
This is for the Family Council for Prevention Programs. Is that what it's
Yes,
called? Okay.
yeah,
So I talked to both Catherine O'Day and Craig Pinkham. And Catherine is brand new, really interesting to talk to her because Craig has been on the council for over 20 years and is the chair. So it was a great perspective. They both are great. I had wonderful conversations with both of them. They have really good perspectives, and I can give more details, but my bottom line is I think it's wonderful to have them on the council and recommend that we approve them. And I have more details, but I know we're tight on time.
so we'll take your word for it. How's that?
Yeah. And Craig is the executive director of Washington County Youth Services and has just done a ton of stuff throughout decades in Vermont on these issues. And he is incredibly knowledgeable and a really great resource. And Catherine also has worked on a lot of things. She's newer to the council, but has a lot of experience with youth prevention services. So, and also lived experience with the juvenile justice system. And so she is really interesting, but they both are great.
That's good. I mean, it sounds like there's a crossover between judiciary and health and welfare, which is what we always try to do. It's great. Okay, so the two people that you interviewed are, why don't you name them and then we'll take a quick vote on recommending them.
Catherine O'Day and Craig Pinkham.
And are you moving that we approve their appointment?
Yes, I am. Thank you, Madam Chair.
All right. All right, so all those in favor, raise your hand and say aye.
Aye.
Aye. 401. And Senator Hardy, you will report that to Secretary Bloomer. Good, okay. Senator Hooker.
Thank you, Madam Chair. I had Maria Mercedes Avila and Stuart Barry. Both are already on the council and both are willing to serve again. Maria is a member of the Ethnic and Racial Disparities Council. She works on equity issues that affect youth. She's a professor of pediatrics at the College of Medicine at UVM. She's been working on equity issues for 20 years, 2 decades. Stuart has been on the council for 8 years. He is a juvenile justice consultant, a consultant for reform nationally and internationally. He says that he has been a constant reminder to the council to think about family, race, and youth voices. He's had 35 to 40 years of experience in consulting on juvenile justice. I think they're both very well qualified, and I would move that we move their nominations forward to the whole Senate.
Thank you. That was very clear. And so would you mind please just naming them one more time for us before we vote?
So I move that Maria Mercedes Avila and Stuart Barry's names be put into consideration for appointment to the Children and Family Council prevention programs.
All right. Thank you. Discussion. All those in favor, raise your hand and say aye.
Aye.
Aye. Opposed? All right. 401, thank you. That's very good. And you will
And it-
send that along to Secretary Bloomer. Run it upstairs.
Right.
You don't have to run upstairs.
Okay.
All right, I think that's good. We've accomplished a great deal today, and I thank you for your time and attention. And so we have H225 on the, I think it's up for tomorrow. I'll just give a short rendition of things for that one. Then we'll have 171 and S20, so that'll be good. We're set. And anything more you hear about your bills, keep me posted, please. Just let me know if you hear what's going on with S22 or 48, but I don't need to hear it now. That's good. We're good. All right. Nellie, we can